Hi, I'm Dr. Watt, the healthy neurosurgeon. A lot of my patients complain to me about difficulty sleeping. As a matter of fact, they bombard me with requests for prescription sleeping pills. Despite what the TV commercials would have you believe, drugs like Ambien are not completely risk-free. As a matter of fact, they carry a lot of potential for side effects, including potential for addiction, and I think it's best to stay away from them if at all possible. That doesn't mean you don't want to get your sleep. Those of us who've always been busy used to begrudge sleeping, it was wasted time, but we know that sleep is when the body does repair work, not just to the body, but to the brain and the mind. It's also when you make a lot of very important hormones, so getting your rest is extremely important for your health. Now, many people's problem with sleep are psychosocial stressors. If you're worried about paying the bills, if your job sucks, if your daughter's dating a boy named Spike who drives a panel van, then obviously you've got to deal with those issues before you're going to sleep well. And as I've alluded to before, meditation and stress reduction techniques are often beneficial for that. But if you've eliminated the psychosocial stressors and you're still not sleeping, then what do? Well, first and foremost is getting into a routine. Having a regular bedtime is very helpful. Now again, if you're a shift worker or a doctor on call, that's problematic, but if you have a regular time that you go to bed, that trains your body, it's time to go to sleep. By the same token, if at all possible, your bed should be used for two things, and one of those is sleeping, the other one isn't working. You want to convince your body that if you're going to bed, you're getting lucky, or you're going to go to sleep. You make a routine of this. Darkness is also very important. We're diurnal by nature. We were designed to sleep in the dark, so you need to eliminate light sources. Make the room as dark as possible. Blue lights are especially bad. That's why most digital alarm clocks have red faces, but even the red light bothers some people. You don't have to throw the clock away. Put a dark washcloth over it. You can move it to see what time it is, but cover it back up to make the room as dark as you possibly can. Now, speaking of light, computer screens, smartphones, TVs, these all produce a blue-white light which convinces your body it's daytime. So if you can avoid the computer for a couple of hours before bedtime, that should help you sleep. Try reading a real book. When I was studying organic chemistry, I always fell asleep on Morrison and Boyd's Organic Chemistry. Another thing that can be helpful is one of these little gadgets. This is a white noise generator, especially if you're a light sleeper and easily disturbed. One of these devices that produces a constant background white noise can be very, very helpful in getting your rest. If those don't help, another consideration is 5-hydroxytryptophan. Remember the home remedies of a warm glass of milk or the experience of everybody falling asleep after Thanksgiving dinner while trying to watch football. Well, milk and turkey are loaded with 5-hydroxytryptophan, which is a precursor to serotonin. This is very helpful for most people in getting to sleep. However, there can be problems if you're taking certain antidepressant medications and mixing that with 5-HTP. So if you're on antidepressants, talk to the doctor that prescribed that for you before you take this. And even if your doctor says it's okay to do it, put as much time as possible between taking your antidepressant and the 5-HTP. In other words, take the antidepressant in the morning and take the 5-HTP at bedtime. Another possibility is melatonin. That takes us back to light. Melatonin is the hormone that your body makes that says it's time to sleep. You make this in the dark. When you're exposed to light, you don't make melatonin. As we age, even if you're sleeping in the dark, your body makes less and less melatonin, so for many of us, getting on melatonin at bedtime is extremely helpful. So again, get into a sleep routine, eliminate the light, consider white noise. Supplements can help if need be, but by all means, get your rest. It's not brain surgery.